iPad? All right. Good job. You got it.
What if I told you that you could live in a world where you were happy, you had most of the things that you needed and wanted on a daily basis, you were relaxed, in other words, you didn't feel overly stressed all the time, and you were engaged. You had something meaningful and enjoyable to work on during your days. I bet you would say, yeah, being happy, relaxed, and engaged sounds like a good life to me. That's the life I would want. And in fact, that is the kind of life that many of us are pursuing for ourselves and others on a daily basis. Everything we do at Upstate Caring Partners for our services with people with intellectual and developmental disabilities is focused towards creating a world where they have a chance to be happy, relaxed, and engaged. One of the ways that we do this is to create a higher quality of life for individuals by teaching them practical skills that they will need to be happy and joyful in the world. Skills that support joyful participation in their own interest. Skills that help build meaningful connections to their environment. Skills that help them connect to their families, their caregivers, and in the communities in which they live. When we do this, when we get individuals to a place where they're happy, relaxed, and engaged, we find that most of the time they begin to open up. They begin to want to expand their world, learn new things, and to grow as individuals. Most importantly, they learn to be empowered.
Individuals with acute intellectual and developmental disabilities and complex behavioral needs encounter significant challenges in accessing services. Many are denied admissions to psychiatric hospitals, leading to a cycle of repeated visits to the emergency department. This is often one of the challenges with working with individuals with more severe forms of autism, is it's not always quite clear why they engage in those challenging behaviors. Could be to get something, could be to get away from something, and could be due to some underlying medical issues that we don't quite understand.
So my name's Anne Marie Walker-Chiz, and I serve as the president and CEO of Rome Health. And I would say in an overview as the president and CEO of a healthcare system is to design healthcare services based on what the community's needs are. Taking care of persons with disabilities and maybe even severe disabilities within the healthcare network as a whole is commonplace, and I think has been for a number of years. The challenge today really is that the amount of needs are rising. We have an expectation that we provide quality healthcare with compassion, and so when there's really kind of a comprehensive acute need going on, very, very challenging within the healthcare network to meet all those needs and be able to create a safe discharge plan. I think the way through that at a local level is continuing to build relationships with everyone that's serving the community like we did with UCP. I mean, that was just ultimately for me as a CEO a changing point, and that relationships can be continued to be built, and they can change based on what our patients in the community need. So we want to make sure that we're continuing to redesign our healthcare system to meet the physical, social, emotional, and behavioral needs of the patients that we serve in this region.
Upstate is one of those places that to me is leading the way in a humane, dignified, we like to say televisable approach to folks with complex needs. It's a group that's a pioneer. They have led in the implementation of evidence-based practice, but under real-world conditions. What's happening here between FTF and UCP is a true collaboration. I mean, at FTF, we're researchers. We've developed some technology, but understand, to get that technology into the hands of the people that need it, we need true collaborators that will be vulnerable enough to bring us in, let us see their toughest situations, but also strong enough to teach us when it doesn't work and how it needs to be modified. So that's what we have going on between FTF and UCP, is we have a true collaboration.
Certainly, the medical field needs to have a better understanding of individuals with more profound and severe forms of intellectual and developmental disabilities. At Upstate Caring Partners, we work on understanding the individual fully, including possible underlying medical conditions as part of our normal assessments. And the second thing that we do is just crucial, is that we work on essential skills that are going to assist them in communicating out their needs better so that we can provide support around that.
To me, ABA is going to be compassionate care in 5 years. I mean, that's where we're moving. It's not where compassionate care is going to be. Compassionate care is here. Compassion just means make sure everybody is showing concern for the learner in the moment, every moment. That's it. That's the future. That folks with intellectual disabilities are always receiving compassionate care. It's not reserved for any particular diagnosis. We're going to learn about what they care about, what's hard for them. We're going to bring the joy, we're going to empower them, then we're going to teach them skills. And it's not perfect, and it's still hard work, but every year they are becoming more and more expert in these procedures, and kids are leading happier lives every year because of their efforts.
There are no universal solutions to these challenges, but our model, when intensively applied, has brought progress. Our collaboration with capable and compassionate partners like Rome Health indicates a way forward.
Early on in my tenure, I was amazed at the progress some of the individuals were having in our children's programs and wanted to learn more about it. Although we had limited clinical resources at the time, seeing the change in some of the kids we supported was undeniable. The UCP clinical team, led by Dr. Eric Jacobson, and our leading consultant, Dr. Hanley, were presenting our children's model at a local college, and thankfully in layman's terms that I could understand. At the end of the presentation, I challenged our team with a simple question. If we can do this with kids, can we do this with the adults in our programs that have moderate to severe disabilities? Since that time, our clinical team continues to make great progress with children and adults. Under the leadership of Dr. Eric Jacobson and Dr. Mara Vanderzeel, we have made significant investments in our clinical program. We now have one of the best and largest groups of board-certified behavior analysts in the state, and some of the early results for adults are just as promising as those for the children we support. The switch to this improved clinical model has been challenging, and by no means do we feel that we've arrived. There has been and will be continued learning along the way. As in any evidence-based practice, the hope is what we learn will help inform our clinical practices and improve outcomes for the people we support. In that vein, we are committed to sharing this learning and progress with others so the field can benefit from our experiences. There still is remarkably little research available for those that present with the most challenging disabilities. The reality is that robust clinical models are expensive to deliver, but we are committed to seeking resources so that we can sustain the great progress and share it with others. We face significant challenges through COVID and continue to feel the effects of the staffing crisis. However, the success you see with individuals gaining greater independence and joy in their lives have been life-changing. Through sharing resources and successes with partners in the community, such as hospitals and other caregiving organizations, our team and approach has proven its value. All of this gives me great hope for the future and even greater excitement and commitment for what more we can accomplish, and most importantly, what the people we support can accomplish.